So the CHAT program literally stands for Community Health Assessment Team. The idea came to us because we were trying to figure out a way to bridge this gap that happens where we have people who need our help, but they are low acuity. They don't really need to go to the hospital. We think the CHAT idea kind of took fruition from there, and that is putting together a team of EMTs who are volunteers mainly, and maybe partnering with the school and having their health services club come together and the health service class, and then creating this group of people that goes out and meets with people when it's not an emergency. So we could be doing everything from just assisting them with like making sure they're taking their meds daily like they're supposed to, or if they just got discharged from the hospital, checking up on them. We'll take vital checks. We'll even go do lift assists for them if they need it, talk through their health plan if they have one, and answer any questions and maybe get them connected to a resource if it's not us that they need but something else, get them connected to that resource. We started a partnership with the program when Stephanie Cox came in, and we were kind of figuring out a way. She wanted to reach out and have more community involvement in her health services class, and so the goal was to figure out how we could support that, because as we know here, small communities, 80% of your volunteer fire districts are manned by the people who live in the community. And so one of the best ways to introduce the kids to pre-hospital care is to also find a way that they can pay back in their community, have ties to their community, and hopefully maybe one day serve in their own communities.
I think the fact that they're able to give back to the community where they live gives a lot more value, and it also makes them feel a lot more proud of what they're doing and encourages them to continue in programs like this. Getting work-based experience is a great opportunity for them, being able to work with the professionals to learn the skills that they're going to need when they move to the industry that they're pursuing, and understanding how healthcare is so interconnected. So even if they're not wanting to go into being an emergency technician or anything of that nature, understanding what patients may be experiencing and how that might affect the way in which they will interact with them later.
I really like it because it really lets us know how it's going to be once we get into the medical field, and it's nice to figure out what we're going to do, and that can help us look into new jobs.
It gives me experience and gives me the opportunity to see what careers I would like, and it also gives me options to get recommendations and stuff.
It gets us a good look into the medical field because we do take like blood pressure and like temperatures and like the pulse ox and everything, so it gives us a taste of the medical field.
I want to go to nursing school. It's going to help me to get into nursing school, and the fire department can give me really good recommendations and help me get in those programs.
From the kids' perspective, I can't speak for them, that they would be able to tell you what they're gaining from it. What I see them gaining from it is I have watched their confidence levels grow. Just in the short time that we have with them, whether it's just for one term or whether they're coming back and participating for a couple of terms, what I'm seeing is that their confidence level grows. This is a great way for the community to get involved with the fire district and support each other and take care of one another.